Good afternoon. I'm Patty Johnson, coordinator of the Southeastern Council of Foundations EngAGEment Initiative. This afternoon we are delighted to present our program, Caregiver Central Can Connect in Your Community, sponsored by the Patterson Foundation and presented by Michael Corley of the Patterson Foundation and Mary Ellen Grant of Share the Care and caregivercentral.org. Michael, I'll turn the program over to you and Mary Ellen now.
Well, Patty, thank you very much, and appreciate the opportunity to present and discuss this initiative. I'm Michael Corley with the Patterson Foundation out of Sarasota, Florida, and I will start the presentation and start at a 50,000-foot level to kind of position how the Patterson Foundation embarked upon this, because I think it's important to share some of the nuances we experienced, and hopefully it's takeaways that the foundations on this phone call can utilize. And then I'll transition over to Mary Ellen Grant, who will drill down a little bit on the business model and the business plan, and hopefully that'll tie everything together, and then we can go into Q&A. As you'll see on your screen, we recognize that all caregiving is personal and local, and the purpose of this discussion is to talk about a collaboration of foundations and nonprofits that are building a tool and model for funders to efficiently prepare and support caregivers in each community. Just to give you an idea of the agenda, how did the Patterson Foundation get to this place? Kind of the what, how, and why of Caregiver Central. And then, like I said before, we'll talk a little bit about the business plan. In 2010, the Patterson Foundation embarked upon its number of initiatives, and one of the ones was dementia and exploring the continuum of care. And so we had an overall goal. We wanted to transform the management of the dementia continuum of care, but we really didn't know what that meant. And so we started on an exploration of speaking to experts throughout the country and tapping into the foundational expertise that exists to the point where I'd just pick up the phone and call and ask to speak to people and ask to educate me on dementia and the continuum of care and where's an opportunity that a foundation can plug in. And as a result of that, I had an opportunity to speak to probably about 100 people in some form, fashion, or another. So I had the luxury of time to do that. And two noteworthy ones, and this helps explain how we got to the point where we are today, is we had an introduction through our CEO, Deborah Jacobs, to Bruce Chernoff of the SCAN Foundation. I reached out to the SCAN Foundation in California. They were about 2 years ahead of us in inception, and asked them, okay, how do I approach this topic, and how do I determine what direction we're going to take? Simultaneously, we're working with the Sarasota Memorial Hospital Memory Disorder Clinic, and we're getting some guidance from the clinical personnel. And so as we proceeded throughout 2011, they in turn created what we call connective tissue, which means made introductions and relationships to other organizations and entities to continue the education process. The SCAN Foundation introduced us to the Center for Technology and Aging out of Oakland. And about the same time, Sarasota Memorial introduced us to all the Florida memory disorder clinics. And so we continued the quest, and to the point where when we were speaking with the Center for Technology and Aging, we learned that they were a regranting organization, and we said, hey, if you're in our space, dementia, and an opportunity comes about, would you let us know of something that we might be interested in? Well, ironically, about 2 weeks later, I got a call from Dave Lindeman, and he said, you ought to take a look at a grant application we just received from the Florida Department of Elder Affairs and some work that's going on in Central Florida. And from that, we were introduced to Senior Resource Alliance and the idea of this organization called Share the Care in Orlando. Now, ironically, the Senior Resource Alliance I had met at one of the Florida Memory Disorder Clinic meetings. And so now we're starting to triangulate. There's something here, and we're evolving our discussions. Had a conference call with Senior Resource Alliance. They explained the project that the Center for Technology and Aging was discussing and said, you've got to have a conference call with Share the Care. They've created this tool from a grant from the Harry and Jeanette Weinberg Foundation that touches dementia and caregiving. And that's what you'll see on your screen. It became the caregivercentral.org. Now, it's interesting to note as we're going through this process and asking a lot of questions, our project started to evolve. Initially it was dementia, and then now it became more towards caregiving because we started to learn to appreciate the role of caregiving, which then ultimately led us to recognize that caregivers must know that they are caregivers, which led us to understand that all needs are local and helped us crystallize the gap, that there wasn't a tool for matching caregiver needs with local resources. I mean, at the very granular level, almost to the zip code level. Had we not spoken to all of those folks beforehand, we probably would still be on dementia. And honestly, at the beginning of the project, we were looking at from a medical clinical model on how do we build and resolve the challenge through medical clinics. So as we evolved, we realized, okay, we needed a tool and we wanted a proven concept. We wanted to partner with folks that were visionary. Technology is very critical to anything that Patterson touches, so we want a scalable technology and process. We recognize we didn't have the expertise, but as you look throughout this country, and certainly here in Florida, there's a tremendous amount of expertise, and everything we do has got to be financially thrivable. We almost view our investments very akin to private equity, that when we look at a funding opportunity, we want a business model that ensures financial thrivability, and that can take any number of forms, but we want that methodology in place so that the nonprofits that are involved won't have to come back to us 3 to 5 years down the road, because our goal is to exit and leave a financially thrivable operation. Well, about the time that, as we tie it back into the couple previous slides, we were speaking to Michael Marcus, Harry and Jeanette Weinberg Foundation. He said, wow, we've funded Share the Care. They've developed this caregivercentral.org product and tool. And from that we said, you know what, we want to leverage this opportunity. So let me close the loop on how we got here. Our original project was about dementia and the continuum of care. And as you can see in the red outline, should be red on your screen, we created a new objective from what we had learned from all the facets of our discussions, and it resonated from the connective tissue and reaching out to all the different organizations, some that are on this phone call, and said, we're going to create this, we're going to leverage what Harry and Jeanette Weinberg had funded with seed capital and angel funding to create this caregivercentral.org product, and we're going to partner with Share the Care to leverage Caregiver Central and take it to another level. 3 questions that Patty suggested we cover on this conference. Why is TPF interested? And you know, the reality is there any number of ways we could have invested our funds in caregiving, well, dementia and then caregiving, but we wanted a model that we felt like could be scalable. We wanted connectivity and relationships that we felt could be leveraged and taken and replicated outside of one given area. That was very important to us. When we found this fairly proven concept, and it is proven in one area, we said, wow, that's already over the hump. It's had demonstrative success with metrics, so can we take that to another level? It was certainly meeting a need that we had identified as providing very granular information, which you'll hear about in a minute. We studied the leadership team that had created this and the relationships that had created this existing product and success, and felt like that was worthy of an investment. And then, like I said, it met the original goal that the subsequent goal that we had established. Now, we took maybe a little different tack to our funding approach in that we looked to a 3 to 5 year time horizon, going back to that business model and saying, okay, we've got increments of a business plan over the next 3 to 5 years. We will fund increments based on specific metrics being achieved, but also recognizing there's got to be some fluidity in there because things do change. And we don't want to restrict the recipient of these funds to the point where they're constrained and can't leverage what is in the process of being built. But we want to have certainly controls in place, and we do that through the metrics and the reporting mechanisms that we have. So we've got a little bit of latitude and flexibility there that we feel like we can have as a funder, and so that creates a very collaborative relationship with our recipients. And so what is Patterson's involvement? When we approach a project like this, we look at things, like I said, multi-year. We help create the business plan and the modeling, And we're very interested in 3 specific perspectives. One, that's how do you leverage strategic communications to drive this into other areas, to drive it within a given marketplace. So we look at communications and have already brought in experts in communications to help this project move forward. What's the opportunity for technology? And technology 5 to 10 years hence, not necessarily the computers and the monitors today, but the process of implementation, the opportunity to leverage web-based platforms, new technologies, so that it is scalable, and it's built today to be scalable in the future. And there's a lot of work and conceptualization that's done around that. And then finally, the financial thrivability model, which is basically, can it be financially sustainable over time when funders pull back, and is there a model to create and to generate revenue to sustain this product to help drive mission? Because overall, we never want to lose sight of the mission. So that's the 50,000-foot level. And now I'll turn it over to Mary Ellen, who will drive it down to a little bit, about a 30,000-foot level. Mary Ellen?
Well, thank you very much, and certainly we're very grateful to be involved with the Patterson Foundation, but I want to tell you a little bit about how we got here. I am Mary Ellen Grant. I'm the CEO of Share the Care, which is an organization that's been in existence since the 80s and provides caregiver support services, a large menu of services. We operate 5 adult day health centers in Central Florida, Orange and Seminole counties. And so I've sort of been in the caregiver arena for longer than I'd like to admit, but let's say it's more than 20 years. And I've talked to many, many caregivers and many service providers serving caregivers, and we all sort of saw the same gap, and the gap is getting people from the point of just being a good daughter, son, brother, sister, whatever, to identifying themselves as a caregiver early enough to receive the full benefit of any intervention that could be provided to them, and also how do people actually get connected with services. I would assume, just based on my own experience, that most of you listening have heard how difficult it is for people to connect with the services they need in a local community. They may have to make several phone calls to get connected, even in areas where they have 211 systems like we have here in Central Florida. They don't have a specific person problem solving for caregivers and that has special expertise in what agencies provide what service. And so the gap being identifying themselves as caregivers and being able to connect them with potential services that can help them in enough time that it can actually have meaningful intervention before crisis occurs within the family. And so that is the need that we have illustrated there. It's a single point of entry information source recognized in the community, meaning people know about it because you can have great stuff. And we found out through the process of asset mapping that we have wonderful things in Central Florida available to family caregivers, but they were not aware of it. And to provide comprehensive and personalized direction to appropriate services. So personalized meaning it's your situation that we are matching with the appropriate services. It's not just a list of resources and you pick which one you need. One of the things really important to me about the project was that you could go through this process and not even know what question to ask. You can, because you log on to Caregiver Central, which I'll show you later, and we start asking the questions. And at the end, then you will be provided with a list of services. So I think, Michael, could you click me on to the next one? Through my experiences, I had some assumptions that I made when I was analyzing whether we wanted to apply for the Harry and Jeanette Weinberg Innovative Caregiver Initiative funding. And what we wanted to prove were these 5 points, so that caregivers need to self-identify earlier. Okay, if any of you have any experience with caregivers, you may know that when the phone gets picked up to ask for help is often at the crisis point, and the crisis point is often too late to really have any benefit for the family. They're at their wits' end and pretty much have made the decision that they can't keep going. We can put a Band-Aid on the situation, but we can't have the kind of meaningful intervention that we want to have when we're providing these services. The next assumption is community-based fee-for-service programs are underutilized and in many cases unknown. And for example, Meals on Wheels in your communities, you know that they will provide a meal to people and that they take subsidies to do that, but often they will provide that service for a fee. And is that option offered to people? If you want to have meals start today, if you want to have special timing, or you can start and stop whenever you want. If you don't want to wait on a waiting list, you can buy this service and receive those benefits. People don't know about that. Caregivers of all ages have access to the Internet regardless of income. And now every time I present this program, somebody raises their hand and gives a situation where a family caregiver doesn't have access. And I believe that there are those cases out there. But as a whole, and something that we've proven through this project, is that people do have access to the Internet, and they're using it to research opportunities in their community or nationally to get information about caregiving. Caregivers are Internet consumers and will purchase and search for information and services online. Later on, you'll hear our demographic, and I happen to be that demographic, and I do a lot of shopping online for information and for services and products. And the majority of these Internet consumers are able to and expect to pay for services. These generally adult families, adult children caring for a parent, and they're looking to see how far the family resources can go to support that family member. So we heard about from many, many different angles. I could have one of those graphs like Michael has about how many people contacted us about the Harry and Jeanette Weinberg program. We were one of 400 letters of interest that were submitted. 50 went to the next level to do the full proposal, and ultimately 14 programs were funded nationwide for this 3-year project, which will end at the end of 2012. There's a research component involved with that funding, and we're complying with that. But at the end of our funding period, some of the tool will be adapted and be made more general, because that type of research will no longer be required. So what is Caregiver Central? Well, it's this. If you ask me, I say it's this most amazing thing that didn't exist until Weinberg and now Patterson invested in it. And what it provides us with is something that's very expensive at the front end, but is cost effective for the community in the long term, and could even, I don't know if I'm allowed to say this word in the context of nonprofit, but there could be a surplus at the end of it. CaregiverCentral.org is an interactive website which allows you the opportunity to answer questions regarding your caregiver situation. At the end of the survey, which is coded, it's a very sophisticated tool, you will receive a list of up to 9 services that, based on your answers, you would likely benefit from. And then you can move to the next level, where if you say you clicked on adult daycare, you would be taken to a page which describes what adult daycare is. There's a lot of people that don't even know what the services are, let alone are they available in their community. So adult daycare is defined, and then how to choose a quality adult day center is provided. And if they want to go to the next level, they can click into local service providers in your community. And then they will be given actual referrals to different service providers. And as I said, this is 9 different types of services. So we've just implemented in Central Florida, obviously. This initial grant was for this community only. The results for the first year, I just want to say this is limited to the first year, and we'll soon be updating our end of the second year data. But 516 surveys were completed. And along the left, which I don't think you can probably read, is an example of pages from the survey. We had 1,156 users click to access the tool. So some people are thinking about it, didn't want to invest enough time to do it, but will likely be returners. 93 of those people requested case management. They wanted somebody to work them through the local resource process, help initiate into services and such, which our agency provided that case management service. We had 6,772 unique visits and 3,367 return visits. This is statistically a very, very good response for the first year of a new tool. And so from those responses, we can move to the next slide, which will provide you the demographics of caregiving in Central Florida that we have determined via this tool. And that is, this is me. I'm a little younger than this, but age of caregiver is 53.5 years old, and most of them are female, 81%. The relationship is mostly adult-child, other being probably siblings and that type of thing. Level of income, and this is something that we, in our hypothesis about people are willing and able to pay, that we were able to establish, and that is 65% of the responders have incomes $30,000 or over. And then the ethnicity factor is almost identical to the percentages in our Central Florida community. We're about 4% under in the Hispanic side, but we put that out to the fact that the tool is only offered in English at this time. Ready for the next one? So what was the most often asked for topic? And that was basically respite care, needing someone to help care for the person, needing an alternative, temporary alternative care opportunity, adult daycare, in-home respite, those types of services. Hold on a second. There we go. Oops, no, go back, please. Then meal delivery and transportation services. Transportation is a very difficult service to render to the disabled and aged in almost every community. And then getting the information and support that they need online. Remember, these are online tools, or these are internet shoppers anyway, so they would be likely to answer that question. What's wrong with the person they're caring for? The most frequent answer was memory loss. Falls or almost falling, like that would be fear of falling, and depression. Now we're ready. A big component of this project was we couldn't get people who did not know they were caregivers to identify themselves as caregivers unless we somehow made them think about whether they were caregivers, and we initiated a local marketing campaign, which was funded by this grant. We developed television ads. We are doing social media. We do regular print advertising, and we are in the Partners of Philanthropy Orlando Business Journal on an annual basis with pages of local community leaders identifying themselves as caregivers. So a picture of the mayor with his mother, that type of thing. It is active people that you know that are caregivers, so you could be a caregiver too. Public relations, developing the brand. The Caregiver Central has certain colors, certain logos, certain looks, and we've developed that over the past 2 years in the social media, as I mentioned earlier. And then the community campaign, which is kind of the more familiar way of marketing in the nonprofit in the community. And so we were like handing out flyers to businesses, healthcare, civic and churches and government in the same way that most nonprofits would market to people, kind of the less expensive, less sophisticated version, but still equally effective. Good services, best marketing in communities is word of mouth. So we wanted to utilize as few portals as possible to reach caregivers. Next. So you see we have results. We basically proved our hypotheses. I'm not just saying this. We were lauded by our funder as proving our success. It's been a great experience. We've been around the country presenting this model, and many, many communities approached us and said they'd love to have something like this in their community. On the diagram that Michael submitted, where Share the Care was one of the providers that they came into contact with, when we started the dialogue with Patterson, we pretty much had the thought process that we have really successfully completed what we promised to do, the Weinberg Foundation, and that was create an effective resource for family caregivers and get them to identify earlier in the continuum in Central Florida. So based on how many people are coming to us and asking, do you think we could do it here, the idea started to mature that we would like to maybe see what we could do about bringing these these opportunities to other communities. And so we started in the dialogue with Patterson, who found us. And they came to us and said, look, we have these tools, these opportunities, these skill sets that we can bring to this project to help you move it to the larger audience and feed the mission in a larger, wider perspective, and bring this service that you brought to Central Florida to other communities where there's a need. And so our phase 1 of our agreement with Patterson was for them to help us design what we wanted it to look like as we move out of our familiar territory of Central Florida, and helping us decide the structure that we wanted to create, which at this time we have determined a LLC component to the existing umbrella agency. But as Michael said, keeping the flexibility within those decisions to know that if future decisions affect the appropriateness of that choice, that can change. And at this point we have determined how we will operationally deal with it. But again, if we're successful, there will probably be additional changes to the operational structure as well. The business model plan for Caregiver Central has 3 different components, which I believe is an additional slide, so I will hold on to that one. Yeah, but go back for a sec. And so then we're going to identify the product enhancements, meaning the tool. How can we make this tool feel appropriate for whatever community that it's going to? How can we implement it, in a community in the most effective way? And the actual technology component, I think that Michael will agree, is probably the most dynamic part of the whole project, and where we're likely to see the most changes, fundamental changes, involving our plan. And then developing training materials and methodologies, and that means we can come to your community and look, we have this whole list of things that we did with forms and appropriate steps to take, so that you can implement this. You don't have to figure it out like we did. You have our model to use to make your program successful. And then phase 2 is to beta test in a new community, see how what we've planned really plays out when you move to a different community. I think often, because we're a familiar organization in Central Florida and people know us and we have relationships, something can work locally that would be more challenging to go to a community where you don't know people, where you're not known, and to try to implement within the context of a new area. So the next. So the sustainability model requires, I've learned about a model that Google uses. It's called a multi-platform business plan. And that means that you'll have several groups that you have to market to, and you have to be successful with all of those groups in order to make it effective and sustainable. And so we have to have the caregivers coming to the website in order for providers to want to participate. They want access to potential purchasers. If the numbers aren't coming in and the people aren't going through with the tool and finding out about the services, then the preferred providers will not have an interest in that. We market to the preferred providers, showing the statistics that we've gathered about caregivers who have gone through it and about our successes in matching family caregivers to services. And then I often say to people, if you've heard of the Villages project, this is kind of the Villages for Caregivers, in that we screen all of the providers that we refer people to. They go through an extensive vetting process, which is formal and in writing. And so as we provide the quality assurance and people have good experiences, that word-of-mouth marketing occurs, and we are successful in meeting the business model providers. Can you click again? So family caregivers, they have to hear about us through marketing. We have to implement the marketing plan and use the tools that we've developed in whatever communities that we go to. The service providers will be called members, and there will be a limited number of members that are allowed in each category of service. So, 5 adult daycare providers, 5 home health providers. I'm just making that up. It could be more local communities based on how many providers they have that they could provide opportunities with, can choose a larger or smaller group. And those members pay dues to be a referral, to receive referrals, and those dues go to supporting the sustainability of the project. And then how do we get local communities to invest in this project? And I believe that what has happened with Patterson could be a model. Patterson bringing us to Sarasota, other funders will see the need in their community and support the actual implementation side, understanding that this will ultimately be a sustainable project and will not continue to be a drain on funders in that community. Okay, so our future goals and expectations. When Michael talked about the mission and always staying focused on the mission, the reason that we started this project in Central Florida was because our mission is to provide services and support to family caregivers. And so when we developed this product and implemented this particular project, we saw that as feeding to our mission. And so the use of the web tool by communities is a larger implementation and an augmentation of the mission to other communities. It's also an entrepreneurial opportunity for Share the Care. Empowering the existing service providers, and one of the reasons that I also really enjoy this project is because it's an opportunity for us as a nonprofit to behave more like a business. My philosophy has always been when you create a service for recipients, the quality should be the same whether they get it for free or whether they purchase it. But what the problem in the nonprofit or the challenge in the nonprofit community is for them identifying their product, putting a price on it, and actually selling it to the people willing to pay a fee to feed their own mission, to continue to be able to support those that are unable to pay. So empowering the providers, to bring the nonprofits on first in the community, teach them how this can benefit them, and I envision it being a nonprofit service provider in every community taking a lead in it. Then the social entrepreneurial model of us is that it's several levels for Share the Care. Share the Care is sustainable plus just doing the basic product here in Central Florida, but by becoming consultants, by our franchisers or whatever, bringing it to other communities, we can also be a better entrepreneur and bring more resources into our own service delivery system here in Central Florida. And then I just think this is the most important part. Increase the ability of individuals and communities to identify what caregiving is. And that so many of us, I think almost 100% of us, will experience caregiving in some way. And since that is the case, then it is to our advantage to understand what caregiving is, to understand programs, and make sure that programs for family caregivers are available in every community. Because the bottom line is, if we don't help people keep people at home and in the community, and they end up taking the most restrictive level of care, that's also the most expensive level of care, and the one that's most likely to be a drain on government funding. So I think it has like a universal kind of cyclical effect on the whole entire nonprofit and just societal context in which caregiving is known. And so we hope to develop the resources to make all of the above possible. I'm going to tell Michael that I just did it in record time. He always thinks that I need to be monitored on my length of time talking about this. But that is in general what this product does. And I'm very excited by it. In 2 years, we've created something from scratch that has shown to be effective. I have had a lot of ideas in my life. I spent a lot of time thinking up cool things to do, and this has been the most successful. And so as a leader of an organization, I'm excited about it. I think that we would have been happy with Central Florida, but Patterson has stepped in to allow us to go to the next level and to bring this opportunity to other communities. And I think that is magnificent, and everyone I talk to is excited about it, and that's pretty much it. So I finished way ahead of time.
Well, you certainly did. And from a funder perspective, our objective is to harness this passion that she has and the expertise and ability, and put structure and vision to it to the extent that we can, and make sure that it's not that this thing does not succeed because of a lack of funding if there's clearly a defined need and a defined model. And so we welcome any questions at this point, or certainly subsequent to this phone call. You see Mary Ellen's contact information on this screen. My contact information was on the first screen. I can always be reached at the Patterson Foundation. And Patty, we'll turn it back over to you.
Okay, we'll certainly take questions, and I have one already that's been sent to me via chat. And the question is to Mary Ellen, once members are selected, how long does their term as a member last? 1 year, 3 years, perpetuity? What's the deal?
As we're designing it, and when we implemented it, it was easy because the first year the members were free. Mm-hmm. So the second year they were required to pay a fee. They've already seen the success of the project. And so we are doing it on a 1 year basis, single year basis, because there's also quality assurance that has to be continuous and has to be kept up with, and that is one of the expenses of the local provider, is to maintain this level of quality assurance. So it provides an opportunity to reevaluate on an annual basis.
What is the fee?
$1,000.
Okay. Other questions? Does anybody else have anything like this in their own communities, or thought about it? Or?
Patty, there's another question on chat.
Okay. Yes. What does it entail to be a beta site for the project?
Well, I think right now 2 primary things, and that is a funder interested in bringing it there, and an agency with the scope and the reach to make it successful.
Okay. Does that answer your question sufficiently?
And what I will say, Patty, and this is Michael, is and we continue to reserve the right to evolve that as we learn. As we move into Sarasota, and we're already beginning to learn the nuances of a different marketplace, and so we're maintaining a lot of flexibility and recognizing that different markets can mean different things. And one of the things we're consciously trying to do is build that criteria for success, so that if XYZ marketplace calls, a funder calls and says, hey, we're interested, how can we do this? We can have a set of criteria and understanding to increase the likelihood of success, and we'll continue to do that at each opportunity.
And as I said earlier, I have received quite a bit of interest in it, but obviously the most important thing to us is to have every replication be successful. So with the help of Patterson, that will happen.
Okay. Do we have other questions, comments? As a recent caregiver, I find it very interesting. I wish you had been in the Atlanta area.
We'll be there for you.
Help me out.
Do you find, can I just ask, do you find that it's difficult to find what you need in your communities?
I think it is, for the simple reason that researching whatever topic is what I do, and if I had trouble finding it, I think other people would have trouble finding it. And it's been, word of mouth, and then how do you verify things, that sort of thing. I can't tell you how difficult it was here to find a listing of support groups for caregivers. Just a place to go meet others and talk. And I was surprised. That it should have, to me, it should have been easier.
Well, Patty, that's what we learned in our research is you can multiply that 1,000,000 times over. You can get aggregate information and general conceptual information, but once it gets into drilling down into the local community, it becomes very, very difficult, and it's hit or miss. And certainly if, especially here in Florida, if the children live outside of Florida, and that was really a driver for us as I spoke to a number of caregivers that were out of state and had one heck of a time. What are they going to do? If you're not in the system, and most of us aren't, it's very difficult to identify the resources and even understand what's available in a given area.
Yeah.
So very, very unfortunate. And so if through this tool and other tools, and as this project evolves, which updates are, we continue to put on the Patterson Foundation website, on our blogs. There's a Caregiver Connect update. We try to update what's happening. So please feel free to comment and ask questions based on that, because our objective is we don't have all the answers. We've got a general vision, and certainly Mary Ellen's driving that. But welcome input from anybody on this phone call, any other experts, to help us figure out the best way to do this.
We have a question related to what you were saying, so maybe you could repeat. How can I find out about updates on what's happening, what's going on with this project?
Well, certainly with the Patterson Foundation, we update things regularly on our blog, almost to the point of weekly, under our various initiatives. And certainly this is a very active initiative right now, and so you'll continue to see information put into that. And from that you can ask questions, and you can certainly reach out to Mary Ellen or to me directly for more updates. And then as the beta gets implemented into Sarasota, we'll have more information. And in a blog, you've got to keep it somewhat high level. You can't get into a thesis, but we'll continue to try to drill down and provide the pertinent information. And that's at thepattersonfoundation.org.
And can I say, Patty, that any community that has access to the Internet can log on and take the survey now.
Oh, okay.
The only thing that's lacking, will be lacking somebody who's not in Central Florida, is the connection to local resources. The local resources that you would receive at the end of the tool, at the very end of the tool, would be ones that are right now would be ones that are located in Central Florida. But if you go through the survey, you will still get the list of services that you would most likely benefit from and the definition of what that service is and how to choose one. So from there you would have to probably pick up the phone and dial 211 or look in the yellow pages for home health agencies or adult daycare. But you can still get that list right now as the tool exists.
Yeah, one would think that list, that survey, would be a starting point for someone.
Definitely, and we expect and we have seen that people revisit and retake the survey as their caregiving experience changes and evolves.
Patty, one thing I want to be sure to clarify, we talk a lot about private equity and a business approach and business planning, and this is not a for-profit model. The idea, and one of the overriding objectives, which it wasn't stated, we just didn't have time to state it, but Mary Ellen has done a fabulous job trying to create a revenue model to make money to help her drive her institution's mission. So funds and monies made from this will help drive her mission. Embedded in this model is also opportunities for the local agencies that will be partnered with in this effort to create revenue to help drive its mission. And so it's certainly it's a collaboration of nonprofits employing some business practices which maybe are unique to some, but probably upon further reflection aren't. So that there's money being made to help further that mission. And so right now, there's nobody in the for-profit world doing this, and don't envision that being the case, certainly not through this methodology.
Mm-hmm. Okay. Well, has everybody's curiosity been satisfied? Not seeing or hearing any more questions, I want to thank you, Michael, and Mary Ellen for pulling this informative program together for us about caregiving and about a way that has been developed, a self-sustaining way to provide information for caregivers. Don't forget to fill out the webinar survey as you leave the Ready Talk site. And don't forget our webinar next month on February 15th, Vision Rehabilitation in Older Adults, hosted by the Alabama Eye Foundation and presented by Tori DeKaiser of the Alabama Eye Foundation and Dr. Dawn DiCarlo, Director of the University of Alabama at Birmingham Center for Low Vision Rehabilitation. That promises to be an interesting program, too. So I thank you all for coming, and if you do think of other questions you have, Mary Ellen and Michael would both welcome your call. Any other announcements about anything? Then I'll say good afternoon to you. Hope you have a lovely rest of the day.
Thanks, Patty.
Thank you. Please stand by.